Nearly 158,000 breast reconstruction procedures were performed last year, making it among the top 5 plastic surgeries for the second year in a row.
It's a procedure women and some men undergo after a battle with breast cancer. Joining us now in studio is plastic surgeon Dr. Richard Chaffoux. Thank you for being here.
Pleasure.
It's good to see you on the afternoons rather than the mornings.
Right, exactly. It's good to see both of you.
Instead of the nights. Yes,
yeah,
thank
exactly.
you. Good job.
So let's start with this. Can you talk to us a little bit about breast reconstruction? What exactly is it, and how is it tying into Breast Cancer Awareness Month?
Sure. So it's a great month to talk about this because unfortunately breast cancer is the second most common cancer in women after skin cancer, and it's the second cause of cancer death in women after lung cancer. So it's a big problem, as you said in the opening segment. 158,000 breast reconstructions were done in the United States alone last year, and that does not include the global scale. But what breast reconstruction is all about is trying to restore the shape, the form of that breast after a patient's undergone breast cancer surgery, which could be something as small as a lumpectomy, which is a localized removal of breast tissue, sometimes associated skin, to a full mastectomy, or where the entire skin envelope, the nipple, all the breast tissue are removed. Obviously, it's a more complicated operation based upon the extent of the surgery.
But why is it a good option, though, for breast cancer survivors?
It is because it's patients that have had breast cancer, and I've been fortunate to take care of some of these women. It's a devastating illness. Obviously, you're facing your own death. You're going through radiation, chemotherapy, and it's part of that journey to make yourself whole again. And we have such great technology today that we can use, either using a patient's own tissue on its own, or sometimes combined with, for example, I brought some examples of implants. All of those can be used to reconstruct the breast. And what's amazing about the implants today, they're very, very soft-shelled. The material inside is really more like what we call a gummy bear material. So it's not a liquid material. It feels much more like breast tissue than it has before. And oftentimes, if a woman decides to have breast reconstruction done, depending upon the stage of the disease and consultation with the general surgeon, we can oftentimes combine that breast reconstruction with the primary surgical oncological operation, so they're having one procedure essentially at that one time, and then the reconstruction, if it's more complicated, may take several stages.
And is it available for everyone, or what are some of the key factors that if you're looking into the reconstruction that you need to keep in mind before you go in and say, hey, I want this done?
Right, so the important thing is you really need to talk to whoever is your breast oncologic surgeon, which typically is a general surgeon. The surgeon is going to be doing either the lumpectomy or the mastectomy. In that situation, you need to have a good dialogue. You want to know, what's the stage of the tumor? Am I going to be facing radiation or chemotherapy afterwards? What is going to be left after the surgery's been done? And then oftentimes the general surgeon works in close concert with a plastic surgeon, whereas essentially we'll be doing the reconstruction after the tumor has been safely removed.
You sort of talked about the goal earlier, but how long does a surgery like this actually take?
So that's a great question. It really depends upon the extent of the disease. Obviously, if they have a very early localized disease, sometimes we can use the patient's own tissue. For example, fat tissue can be injected to restore the shape or volume of the breast, and that might be a very shorter operation. If it's a more extensive operation, that can last several hours to have the mastectomy performed, and then the reconstruction, if it's using the patient's own tissue, that might be a localized flap. That could take several hours, with or without the use of what we call tissue expander, which expands out the skin, or reconstruction with an implant. So it really has to be tailored to each individual patient and their particular diagnosis.
And what does recovery look like, or how long is recovery?
Sure, so recovery can be anywhere from being essentially an outpatient procedure for a lumpectomy to being a procedure where a patient may require hospitalization overnight or for several days, depending upon how extensive the reconstruction needs to be.
And very quickly, what are some of the risks that are associated with this?
So like any surgery, the risks are things like bleeding or infection, poor healing. We do know that unfortunately women that undergo more extensive mastectomies associated with radiation and chemotherapy tend to have more complications in terms of the reconstruction because of the vascular supply, more risks of infection, more risks of exposure. So it's a long road, but obviously you want to get a surgeon who is very skilled in both the cancer surgery and then also in terms of the reconstruction.
All right. Dr. Chaffoux, thank you so much for being here this
Good to see you
afternoon.
both. Sure, my
Thank you.
pleasure.